Action.
Concussion testing through the IMPACT program is a way of testing the cognitive function of athletes with head injuries. By taking a baseline test of their brain function, both speed, vocabulary, mathematical, and shapes, that's not good. The IMPACT program allows us to do neurocognitive testing of head injuries of various athletes. Neurocognitive testing allows us to test speed, accuracy, vocabulary, and mathematical and shape skills that allow us to understand if the brain function has been impaired at any one of these levels. Sometimes MRI and CT scanning is not enough to understand brain injury, since they only give us anatomical pictures, that is the structure of the brain, but does not really tell us how the brain is functioning. So through IMPACT testing, which is a computerized test, and both gait and balance analysis, we can better and more accurately prognosticate, in other words, predict injury and recovery than we could prior to these technologies being available.
Action.
IMPACT testing also allows us to more accurately diagnose, and sometimes many times allow us to more quickly allow return to play with more accurate and safe return as far as their brain function and injury. The concern of many coaches is that IMPACT testing will hold their players out of participation. However, in most cases, we were able to return the patient to athletic activity much more quickly because we were able to do a test and compare it to their baseline and know things haven't changed and that we can safely allow them to play.
Ready, and
baseline testing generally is done at 7th, 9th, and 11th grade levels, and this is done here locally in our sports facility at any time, or you can make an appointment, and there's various times through the years when they do it at various schools. So sometimes just check with your athletic director or principal, or call our clinic and they will let you know if there's one available at your school or if there's one here at the clinic.
action.
We are also participating with Allegheny General Hospital in some of the newer testing with IMPACT-like tests and other neurocognitive testing technologies and programs that are coming out. Through Allegheny, they are now testing in side by side the different programs and protocols to see if one has some superiority or advantage that would allow athletes to and doctors to more easily ascertain whether the athlete has a head injury or not. One of the aspects of sports medicine that we are trying to bring to the area is the preventative aspect. This means programs such as our throwing program, ACL prevention program, and even more specific refined programs that we can come up with for different athletes in various sports to help them be not just better athletes, but to prevent them from being hurt so they do not have to use the hospital and clinical facilities, and hopefully they would not only be better athletes but get through their careers without significant injury. So that is one of the goals. And there's many aspects to that. Sometimes it could be specific training for a sport like golf, which would be different than training for a sport like football. And this can be done with different sports, and as the time goes on, we hope to add some of these things into the programs in addition to the throwing and ACL prevention programs. That's good. As with any sports medicine physician, being on the sidelines is a highlight for us. We like to be in touch with our coaches and players and our athletic trainers. However, many of the times we can only be in one place at one time, and that's why we have certified athletic trainers at big sporting events to help athletes with injuries, and also to help them prevent injuries and getting taping and other preventative measures, such as making sure they're drinking enough water, they're using proper hydration, Gatorade, all those things that goes into pre-game and during the game activities that are important and many times missed. And these sound somewhat unimportant, but very important, and the athletic trainers really help extend the physician presence to other sites that the physicians cannot be present at. And they are our eyes and ears, and many times, and the well-trained athletic trainer knows well what's going on with athletic injuries and when something is serious and when something isn't. I'd say most of the time when I get called from an athletic trainer about an injury, it's important and significant, and they also know when maybe somebody's trying to push the envelope a little bit, making an injury sound a little worse than it is. But anyway, the athletic training program, providing trainers to various high schools and facilities, I think has been a true a medical blessing for the schools in our area.
Action.
Sports medicine as a medical field has a wide variety, which can include cardiac and lung function, because obviously that's important in athletes, along with the musculoskeletal system. But also that applies to workers who get injured, because many times the workers that are doing especially strenuous work have injuries that mimic a lot of athletic type injuries. And getting back to work in a timely manner is just as important, if not more so, than getting back to a sport. So we try to take care of our working athletes like we do our high school sport athletes. And also that's true with any age group, keeping different athletes on the field, whether they be the weekend golfer who's 65 or the high school golfer who's looking to get a college scholarship and having a great year, and everywhere in between. I think that one of the things about sports medicine is that you treat a wide variety of people and problems, and it always keeps you thinking and trying to problem solve to help patients with their specific issues and problems. And it's a good team approach of having individuals, whether they be athletic trainers and physical therapists, bracing people, nursing, and people that all are on this team that helps the physician take care of the patient the best that they can.
And action.
Rehabilitation services are a very important part of sports medicine. No matter whether you have surgery or any of our procedures we do here, or you have a non-surgical injury, the rehab component is critical. You could have the best surgeon in the world do your surgery or your procedure, but if you don't have appropriate rehab, sometimes the outcome isn't as good as you would like. Our sports medicine rehabilitation program includes physical therapists who have extensive sports background. Our main therapist, Perry Pritchard, is actually a licensed physical therapist and an athletic trainer, certified, and he still does high school work, and so he's involved in sports on a regular basis. Penny does still referees soccer, was a college soccer player before becoming a physical therapist. So again, she's well versed in the athletic injuries and the athletic culture. I think that they provide excellent rehabilitative services, and being in the same facility with myself and the other people in the program, we can make a tailor-made rehab program that can be adjusted as needed, many times the same day, since we're in the same facility, which makes the advancement of the athlete to get better even more quickly, or even quicker, I should say. Yeah.
very involved in all sports. We play it all. And Dr. Scarpone helps us stay healthy. My name's Anthony Pierros. I'm from Steubenville, Ohio. I've lived in Steubenville all my life. These are my sons and my nephew. We're very involved in all sports. We play it all. We get after it pretty hard. And Dr. Scarpone keeps us all healthy and keeps us moving and directs us all in the right direction. We live a very busy schedule. You know, they all play different sports at different levels. And it's very hard for us to make appointments and do things like that. And Dr. Scarpone always is more than helpful, getting us in different times, squeaking us in here, sneaking us in the back door, the front door, whatever door we have to sneak in. With rehab and everything, he's really has helped our family tremendously. My oldest son, Anthony, had a navicular... Okay.
Ready and action.
My oldest son, Anthony, had a navicular bone in his foot that was cracked. The x-ray did not show it, and Dr. Scarpone knew there was something wrong. He took an MRI, still didn't show it. He took a CAT scan, it showed the bone was cracked. He referred us to a doctor up in Pittsburgh that took care of things and was actually shocked that we went to that type of levels to find it, because it was very hard to find and very hard to heal. My second son, Jojo, had a Lisfranc fracture being tackled in a scrimmage game against Uniontown Lake, which is when your bones in your foot get crossed up. And Dr. Scarpone explained to me the history, why it was called a Lisfranc fracture, and the therapy and everything, and put orthotics in his shoes and got him back onto the... Actually never left the field. He continued playing as he was recovering from the injury. My son Brian, making a tackle, another kid landed on him and broke his, whereas the foot and the ankle and the leg got together, broke his growth plate, and which was a very difficult injury to heal. And Dr. Scarpone sent us up into Pittsburgh, and he was handled very carefully and was back onto the field the next year. And the two younger ones, so far so good, knock on wood. Well, hopefully they won't see him.
Pierros. If you want to get back on the field quick, go to Dr. Scarpone. We are the Pierros. And if you want to get back on the field quick, go to Dr. Scarpone.
Now what are they going to look at?
Action.
We are the Pierros. And if you want to get back on the field quick, go to Dr. Scarpone.
And action.
We are the Pierros. And if you want to get back on the field quick, go to Dr. Scarpone.